Welcome to the Thinking in Between podcast, where we explore the borderlands between health and social science. In each episode, we invite someone working in these borderlands to share 3 big ideas that have shaped their thinking, research and practice. And today, I'm glad to welcome Dr Sara Paparini, Senior Lecturer in Public Health and Equity, who's based at the Wolfson Institute of Population Health, Queen Mary, University of London. And she also happens to be one of my PhD supervisors. So Sara, thanks so much for being up for this, and could you start by introducing a bit about your career journey so far?
Thanks, Stephen, and thanks for inviting me, and I'm glad that we've switched places because I now feel like I'm being supervised. I studied anthropology as my first degree a long time ago, and then I studied research methods for health and social policy PhD. As a result of spending a few years as a researcher in a HIV clinic in between my undergraduates and my PhD. So then, since then, I've gone on to work as a social scientist more broadly in different medical schools. I worked in the London School of Hygiene and Tropical Medicine, and then I worked for a time at the Graduate Institute of International and Development Study in an anthropology department that's in Geneva. And then from there I went to work at the University of Oxford in the Primary Care Health Sciences department, and I have now been at Queen Mary for 3 years in the Centre for Public Health and Policy. So I've gone from kind of anthropology to more health services research to now focusing a lot more on public health research.
Thank you so much. So the first idea that you're bringing today is how knowledge is power. So can you tell us what do you mean by that, and how's that shaped your thinking?
So when you asked me to think about the ideas for all these years of this quite sprawling and varied research that I've done, in common with many colleagues who are social scientists in medical schools and do health research, we often bring theoretical lenses and methodological lenses to all sorts of different more medical or clinical issues. So we tend to think across rather than maybe in the specificity of an illness or a medical problem. But I would like to go back, and this, I hope the listeners will forgive me, this first bit, it's a little bit, it's a bit of a journey back into where my thinking comes from more generally, and how I've, what my intellectual/academic journey has been. So I grew up in Italy, and I was taught in a secondary state school where we could have orientation, so more what we would call more classics or more kind of the sciences. So you could choose to study more humanities and the classics, or you could choose to study more scientific, other scientific disciplines. And in my school, we did for 5 years, I studied a lot of Greek and Latin. And what we were taught was in terms of schools of thought. So we would study at the same time Greek history, Greek philosophy, and Greek literature, say, for example. And we would study, therefore, the connection between what was going on in the literature, what was going on in actual Greece, what was going on in the language. So same with the history of the Roman Empire. We would study the language, the art, the culture, but also the wars and all of the discoveries made around that time, also in terms of science and technology, if we can call it that. So I grew up understanding that there are these schools of thoughts that permeate a particular period of time, and these schools of thought can be dominant or less dominant, and naturally they are also instrumental to the maintenance and the organizing of power. And we now call it Greek civilization and Roman civilization, but these were all empires. And so in my head, it was cemented from the beginning that the way knowledge is made, Caesar was an author, but he was also an army man. And so you start to understand that those in power make certain forms of knowledge, even artistic kind of cultural knowledge, that it's not about the organization of power. And that there is no real division in the way in which knowledge is made and the way in which power is distributed and upheld and resisted and so on. And particularly, I was very, understanding that these were imperial forms of knowledge, which is important. I'll come back to that in a second. The second piece, again, was part of my adolescence, really, was I read an enormous amount of Holocaust survival literature.
Right.
I was very, very interested in that. I was particularly influenced by the work of Primo Levi, who was one of my greatest passion. I read all of his books, and I read many of those books about the Nazi era and the Holocaust. And so at an early age, I started to form this idea that there is a scientific justification for racist ideology, classification, structures, and that there is an actual scientific experimental element to racism and vice versa. That was very clear from the beginning because it was so imbued with the Nazist ideology. And so when I came to the UK to study anthropology, which was my first degree, I studied cultural anthropology of the kind of old school. So it would have been in the late 90s, and we studied classic anthropological topics like kinship and religion. But we also did ethnographies of long periods of like a year of studying ethnography of India, a year of studying ethnography of the Caribbean, because of course we were in the UK and we are learning about the anthropology of the British Empire. So I'm back with the empire again, and I'm back with learning about the British Empire through the lens of anthropology this time. And as part of that, we did a lot of studying of racial classifications in the colonies and all the different periods of how this sort of started to emerge. So it was different 17th century as opposed to 18th century as opposed to 19th century. And learning about how the politics and economics of the empire and of the slave trade, the transatlantic slave trade, had an effect on the ways in which racialization was represented. So there are some incredible books that we studied, that describe the colonies and the people in the colonies, and all the scientific / moral / whatever you want to call them, justifications for maintaining those structures and imposing those regulations on the colonies. So again, it became quite clear to me how the practices, including the practice of ethnography itself, were implicated in the making of knowledge for the upholding of these racist ideologies and structures. And so I also then studied how anthropology went through this period of crisis in realizing how much it was part and parcel of this process. And so a lot of the reflexive turn in the 1970s and kind of turning anthropology onto the self, to understand its role in the colonial endeavor and in the post-colonial world. And as part of that, I took a course, I remember, which was called Knowledge, Science and Technology, which was one module. I think it was broadly what we would now probably, it would be like STS, or where we looked at the early Donna Haraway work. This is 1997 or something like that. Latour, we studied a lot of Bruno Latour, and it was the first time that it sort of, again, was cemented in my mind that all scientific endeavors are forms of culture, including the medical ones, the lab, the basic sciences. And so they fall back under that knowledge is power kind of way of thinking, because they can be studied as expressions of a particular culture at a particular time.
I still remember you saying to me one time, do you really think we're going to be talking about cells in 100 years' time, but like as just a concept, and that being even without the power element there, the thought for me that these were not just things that were
static
there was a
things.
way of reading in, this is a present snapshot, Yeah, sorry to interrupt. But
No. That's absolutely one of those things. And because it's easier to get our heads around how, the theories about the superiority of the Aryan race has to do with Nazi propaganda, but it's harder for us to get our heads around how, what is the role of something like the discovery of the cell or pasteurization, and how does that relate to everything to do with power and particular forms of organization, between different states and countries and peoples at that time. It is a journey, but essentially that opened up. That was my first thinking about things like medicine and science, and laboratory research and basic science and immunology, and that was the beginning of me looking at that particular aspect more closely. And so let's say I'm like maybe in my mid-20s at this point, and so I've got this quite clear sense that all forms of knowledge are subjected to this kind of principles, and that they're historically situated, they can be dominant or subversive of power, that they are politically they're implicated in politics and politically driven, and so that there isn't such a thing as a kind of neutral science at any point in time. And that the people themselves, the scientists themselves, the scientists ourselves are also, social, historical, political agents situated at a particular time. So even though we don't necessarily consciously wish to support a particular status quo, we nonetheless do as a result, or nonetheless might, as a result of a lack of reflexivity, or just as a result of the position we occupy in the world at a particular time. And we've got here a lot with the decolonization agenda in which we are now. Agenda is not the right word, maybe objective, in terms of understanding that we need to kind of understand ourselves and how we do things first and foremost, to understand what, to which point we are reproducing certain colonial approaches. So when we say knowledge is created, when I say knowledge is created, for me, it's not just in the kind of constructivist sense of, we are co-constructing the world as we go along and we make sense together of things, but the fact that I actually believe that there are underlying currents and specific agendas that are not always immediate or always kind of intentional, but they are they underpin a lot of our knowledge creation, and that not all the knowledge making is of equal weight. So there's a reason why certain forms of knowledge making are privileged versus others, which leads to the reason why things like participatory methodology have the capacity to transform the way we make knowledge, because they are normally more subjugated forms of knowledge. And for example, indigenous knowledge in the colonies was obscured, dismissed, erased, but also bits of it were taken and then used and reproduced as scientific discoveries of the colonizers, So a lot of stuff, for example, around, medicine or herbal medicine or understanding of the body were extracted. Whilst at the same time, the people whose knowledge that was were, subjected to silencing and oppression. And it still continues with indigenous methodologies to this day. Yeah. So we have a kind of little summary, if I can. There's a couple of things to add, but essentially, so if I think that science is kind of an expression of culture, we've already said that. And therefore, the subdivision between something like the clinical science and the social science, it's just a heuristic device we use to understand each other, but it doesn't actually, to me, they're not distinguished in any way. And culture is a sort of a mechanism for accumulation, conservation, redistribution of power, which I look at as such. So all of its expression, I look at them under this particular lens, using all sorts of scholars that have done this much better than I can explain myself. For Foucault being possibly the kind of, at the forefront of looking at the power effects and knowledge and all these things. But I don't want to go into that today as much. One thing I haven't said is that it's important to it's very important for us to self-reflect on our role in what we do all the time and how we might reproduce particular structures through our knowledge making, but also the potential for transformation and resistance. So it's not that there is one form of knowledge, one form of power, and that's it's a sort of everything is extremely dialectical. And the forms of resistance and the ways in which people resist can be just as they can kind of flip the script and become just as hegemonically relevant as that which is produced by a particular institution or more authoritative form of knowledge. So it's not to say this is it's not a one-way street. There is always counter knowledge and debate and counter narratives and so on. So I think it's important to then unpack what this means for somebody that does the kind of work that you and I do, or that works in the kind of institution that we do. And I think that's why the Ian Hacking for me, is a very helpful. His work is very helpful because it's extremely complex, but it's quite clear at the same time.
Well, let's get into it. So the second idea then is Ian Hacking's writing on making people up. So back over to you, Sarah. Tell us what is Hacking trying to say, and what are we talking about here when we're talking about making people up? Right.
So Hacking is amazing at using the right amount of words, and I am very bad at it, as you picked up from now. So if you hear rustling, is because I am looking at papers, so that I make sure I use his precise language because it's quite helpful. The first thing I want to say is I want to acknowledge Professor Vinky Nguyen, who is the person who put me onto Ian Hacking's work when we were working together in Switzerland, and it's been very helpful ever since. So Ian Hacking is a philosopher of science, and he has written a wide variety of books, all of extreme relevance to people working population health, particularly, I think. And he gave this lecture, that is what I'm reading from, a British Academy lecture in 2006. And this lecture, in this lecture, he kind of synthesizes all this, what does he call them? His mottos that have been running through all of his more specific books, which are more about specific issues. So making people up, he says, refers to the ways in which a new scientific classification may bring into being a new kind of person, conceived of and experienced as a way to be a person. So his kind of twist is that he's saying that certain kinds of people did not exist prior to the emergence of classification practices around their very existence. When he says they did not exist, it doesn't mean that they didn't exist in the world, but they didn't exist as those people, and they weren't conceived of as such people, and also often they did not experience themselves as that kind of person, because that kind of person didn't exist before. So he gives a lot of examples from, he talks about multiple personality disorder, he talks about obesity, he talks about autism, famously he talks about homosexuality, and he has many examples of how of making people up. And they're not all the same. They don't all work in the exactly same way. But they are all examples of the emergence onto the scene of a kind of person that before didn't exist. Although the people themselves existed, they didn't exist as how we then see them. And the second kind of linked aspect is what he calls the looping effect. And that's is about how the classification interacts with the people classified. We can come back to that. The looping effect is particularly exemplified by kinds of people, for example, taking these labels that they have been given by our scientific classification systems and using this to live in the world, but also to resist or reclaim or make claims in the world. And so there is then a more, over time, a kind of refining of what then that category means and who it includes, which is in which the people themselves are involved. So it doesn't start as necessarily something that is self-identified, as we like to say, but then people often self-identify themselves as the same kind of person that they have been identified as by the classification system to begin with.
Yes.
Yeah.
And so that even if the classification system that kind of creates the person or makes the person up has a particular vision of what that making up person is, the looping effect might mean that becomes something different.
Yes.
That it's sort of, it does start with that making up, but then it becomes a remaking, that people do things with it that are different when they live that themselves somehow.
Yes, absolutely. Therefore, it's quite dynamic. And now he goes through a distinction right at the beginning, which we can come back to later, which is as he gives us a very strong explanation as to why he doesn't want to engage with particular forms of classification, such as racial categorizations. And he doesn't say that they are not forms of making people up, but because he says these are kinds of people have been made up for what we called earlier on imperial reason or for governmental reason or tributary reasons. So, for example, for taxation purposes.
Yeah.
Long before they were the subject of scientific exploration. So he says some of these, the racial categorization of people predates something like race science, which then becomes a scientific endeavor to classify people.
Okay.
So he's saying it's not the best example as far as he's concerned because it's not the scientific process that has produced these new categories.
Right.
It's the imperial and governmental process that has produced them to begin with, and then the scientific classification came much later.
Okay.
So he said, you had categorizations of race and since the Greeks again and the Romans, but they were not attached to scientific knowledge. But then in the 17th century, you have, the kind of eugenics and the subdivision of the races and all these kinds of things. And there were new forms of making people up, but the people had already been made to some extent.
Okay, yeah. So he's not saying don't apply this here. He's just saying I'm going to deal with things that kind of come after the scientific method is established and is what's kind of giving legitimacy, and the method's what's doing the making up.
That's right. Yes. So it's important because I actually like to apply the framework to racialization, but he does. It's important to note that he doesn't. So then he maybe we just talk about this kind of the framework that he uses. So he has this two very useful lists. The first list is the kind of framework of classification, and then the second list is what he calls the engines of discovery, most of which are scientific and some of which are not. And the classification has this 5 parts. So I'm just trying to find the first list. So classification, you have is kind of, is what we know it to be. You have classes of people that fall under, you have classes of people and then they fall under a particular category. Then you have the individuals and the peoples that kind of belong in these different classes. So in kind of in real life, usually these are actual people, yeah. But in the classification system, they have some kind of common characteristic that means that they end up under the same class. And these characteristics, he says, some are real, he called they are real kinds, and some are finite kinds. So the real kinds are, if we're not thinking about people, but we're thinking about things, it could be something like horses. And the finite kinds are like something like white people, who actually, where whiteness is actually not necessarily the most important thing that they have in common, but is relevant. It can create a class of people, but they're not, or a kind of people, but it's not a real kind of people. So then you have the institutions. So these institutions are the ones that, what he says, kind of firm up the classification. And so institutions can be of different kinds. So you can have institutions like ours, like a university. They can be a government office. They can be smaller scale, larger scale institutions of government. So you've got institutions. And then inside these institutions, you have forms of knowledge circulating about these kinds of people. And these kinds of knowledge, I think later he splits it into two, into professional knowledge, so that's kind of the knowledge of the people in the institutions, and then popular knowledge, so that's the knowledge that the people have of themselves. And then you have the experts. And these experts are, well, people like ourselves. So they are experts inside the institutions who juggle and deal with with the knowledge about this class of individuals in institutions. Does that make sense? So you can go from one to the other and back. So you can go classification, individuals, to institutions, to knowledge, and to experts, and then back from experts through knowledge, through institutions, back up to what is it called? I've lost it. To individuals, to the classification. Now, how does this help us? So we are in the business of what he calls the human sciences. He calls them human sciences, and by human sciences it includes things like psychiatry, the humanities, but also a great deal of medicine. And we are in the business of doing precisely all of the things that the framework talks about. So we are forever classifying individuals and sorting them out into different classes on the basis of characteristics that might be finite or natural, or well, natural is a strong word to use, let's call it real. And we work within institutions that produce this work, and we generate forms of knowledge of which we are experts. And in the process of doing this, we make people up all the time. And we make people up for different reasons. We make people up to help. We make people up to control. We make people up to change behavior. That's one of the things that we do a lot of. And we make people up to understand. We also make kinds of people in order to understand and to understand the differences between different kinds of people. This can be at the level of the human body, or it can be at the level of things like cultural beliefs or health behaviors, or many of the concepts that we work with every single day.
Yeah.
So if we take an example, I don't know if you want to try, maybe we could try and test one of the people, the kinds of people that we make up, and see how they go. I could bring up, for example, from your own PhD. Right? So from your own PhD, we have people living with sickle cell disease. And we've come to it's a very important point. We take these kinds of people as given. We as researchers, thus experts in the institutions and experts in classification of individuals and forms of knowledge about such individuals, we take, nonetheless, even though we're making people up, we always take these kinds of people as given. And even when we are reflexive and constructivist and we understand, we still take their existence as a given, as if they present to us naturally. When actually they are not given, they are not fixed, and they're not moving, and they are actually what he calls moving targets. So the people that we're thinking of change all the time in reality. Our classification starts to include different people from before, and people escape our classifications all the time, and it's terribly annoying when people escape our classifications. One of the ways in which one of the things that signal our making of people is when we think in terms of species. So when we don't say people living with sickle cell disease, but we say the sickle cell patient. Mm-hmm. When we don't say the person living with autism, according to Hacking, but we say the autistic child. Mm-hmm. So we have this capacity to suddenly decide that these are given actual, real kinds of people that somehow have always existed and will always exist, even though we know in history that they don't. And we speak of them in the language of the species, which is quite interesting. People often resist that. You know, the people living with is what HIV activists taught me over 20 years. I'm not a HIV positive patient. Mm-hmm. I am a person who is living with HIV because I'm a person first and foremost, who is living with a virus. Second, I'm not this kind of person because I have this virus. I'm just a person that's living with this virus. Although that also is contested. Some people think that the thing that they are classified by is so important to them that it becomes them. Right. But other people don't want that. Yes. They want that to be just a part of who they are, an aspect of who they are. They're not a particular kind of person as a result of this. Or they are a particular kind of person, but that's not the full extent of what they are. So that's why we try to use, nowadays, we learn to use less acronyms. You know, we used to use then, so we started with HIV positive people, then we moved to people living with HIV, and then we started using PLWHIV, and then people are like, well, I'm not an acronym. Just because that makes it quicker for you to write your paper. You have to spell it out each and every time because we're trying to emphasize that, we're people living with this thing rather than this suddenly you're making us into an acronym. I mean, people don't like being made into acronyms, but we do make them into acronyms. And then we proceeded, though these acronyms were the people themselves. So it's important to think about the people living with sickle cell in your study, for example, obviously existed long before we knew what sickle cell disease was. And they would have had some other understanding of what they were. They would have been seen as something else. They would have experienced the world from a different perspective. They would have been treated based on whatever people thought that was going on with them. They obviously existed before we found out that sickle cell exists. But they didn't exist as the people with sickle cell disease that perhaps you understand and they understand through things like being part of community organizations, being named as such and labeled as such in medical texts, accessing services as a result of being this kind of person. So you see what I mean? They begin to become a kind of person. Yes. And experience the world and the world responding to them. So that's the looping effect as such. Yes.
So if I can just try and apply one thing that I think I'm understanding for the first time there, that if I think about someone living with sickle cell disease in West Africa in, let's say, the 18th century, and there were lots of names, we think, for what we now call sickle cell disease. So one, I think it's something like chwe, which means like someone unable to stop gnawing their teeth. And that's, it is thought that probably refers to people who are living with what we might call sickle cell now. But whatever that was, whether that is a direct link or not, and whatever was happening to people who we now recognise to have sickle cell, their experience of the world, it's not just we can look back and say, well, they essentially had the same set of symptoms, the same set of this, the same set of that, and it's just other factors around them that have change in terms of the medicines that we give. It's that the looping effect has made people different in the way they see themselves, but in the way they experience things, in the way they interpret things, that it's almost as though sickle cell became something different when it was called that and then started to play out at all these different levels, that you couldn't draw a straight line that's just like, we've got a name for it now. It is a different sort of person that never existed before. Is that a fair understanding?
Absolutely, and the key to this, and we can talk about it in a second, is this kind of engines of discovery and the role of medicalization in that, is that once we understand the person as a kind of person, we then tend to attribute a lot of things that kind of person says and does to this new discovery that we've made about them. That's the kind of thing we need to try and hold in our heads. And it seems simple, but it isn't, because it keeps slipping and there's a lot of complications, as he calls them, as Hacking calls them. There's lots of complications in this process. It's not quite as straightforward as it might initially appear. Mm-hmm. But it is important to remember that whatever kinds of people we describe, and through our own description, we are contributing to making them, and that making them will then go out in the world and through the looping effect, interact with those people. And then those people will, as we said, experience the world through that particular kind of person that they have become, or that they might advocate that they are.
Yeah.
And then through that process, they kind of gets pushed back to the institutions and the experts as a way of redefining, sometimes refining, more narrowing down, more precisely, and sometimes it becomes, it's more widening. You start to include people. So he talks a lot about autism and, who might have been considered autistic at different points in time. And now we have a spectrum under which all sorts of things happen. And this was in 2006. Mm-hmm. So now we talk about, we have a whole neurodiversity concept that includes all sorts of things that previously would have gone under that. And we have a lot of people who are finding themselves through these concepts and finding explanations for themselves and living as such. They did not exist before.
Yes.
They existed as people, but they did not exist as people, relating to your neurodiversity.
Yes.
So there is nothing particularly, there can be something sometimes sinister in the way we talk about this, but there is nothing necessarily inherently sinister in this process. It is just the way in which we understand. I think what is more important is that we are not aware of it.
Yes.
And when we are not aware of it, we can then contribute to things like stereotyping and essentializing and making, often we do this through what I find often we do it in our work in academia through a kind of shortening, because we all know what we mean, or we all think we know what we mean. This is not hacking, this is me now. We shorten and shorten and shorten, and then we kind of refer to things in this kind of shorthand. But that shorthand then takes up a life of its own and starts flying, like the acronyms, that I was saying before, and becomes, a kind of factoid that starts to exist out there, and it can become kind of obvious, implicit, and flattened, and we do that quite a lot because we think we know what we mean, but we haven't really often stopped to realize that we are constantly contributing to this process of making people up and, making kinds of people up.
Can we hear about the engines of discovery?
Yes, the engines of discovery. So classification is out of the engine of discovery because it's kind of like what he calls a prior imperative. So we start by the default fact that we all classify. And he says we make ourselves in our own scientific image of the kinds of people it is possible to be. But he says that even though we do this through science, he's not saying scientific method is one and science is one thing. He says there are different engines of discovery. And these are, he says, thought of as finding out the facts in the classic positivist tradition. But they are also engines for making up people. So the engines are 7. And then there's 3 additional engines. The first scientific engines are count, quantify, create norms, correlate, medicalize, biologize, and geneticize. This is the process through which we go. To this, he has added normalize, bureaucratize, and reclaim our identity. Those are the last three. Create norms and normalize are not the same thing. Without wanting to, kind of go on, I think we need to understand that his main objective is really to make us think about this kinds of people as moving targets, to stop us in our tracks when we consider them fixed targets or given, or pre-existing our own classification of them, and to then think for ourselves in all our different fields of research and study, and also our own, he doesn't go so much into the politics of this process, because he says that belongs to the sociologist and the political scientist. He's a philosopher. Yeah. He's not obviously oblivious to the political underpinnings of making people up, which is how we started the podcast. But he's saying that's kind of not my job. That's sort of for you to go and figure out.
Yes.
And then he says, what we find out is for the most part true or not far from the truth. The target is often where it is because of the interaction between our 5 elements, ranging from classification through people to experts. So we're saying that it seems like we find these people. It seems like we find them because the way we look for them is linked to the ways in which we've made them. So we're kind of always going to find them. And I think I stopped there. Wow. Because that was quite a journey.
No, that's fantastic. And I guess I want to ask you to help us see it through an example, but I think that's actually going to be your third idea anyway, right? Of how...
Brief idea,
of how you have applied Hacking's writing and thinking on making people up to racial categorization and racialization, which, as you described, isn't what you drawing on as an example, but something that you found helpful. Tell us a bit about that, of how has this way of thinking been helpful for you in understanding racialization?
So I want to keep this brief. So the first thing I want to say is I'm going to read something from Ruth Wilson Gilmore, which links, I think, the earlier discussion we had about knowledge and power, and knowledge as one of the 5 parts of the classification procedures that Hacking has just described, and how institutions are then implicated in this. So she says the racial state signifies not simply the racist state, but rather more generally the way the institutions comprising the state develop and act legislatively, juridically, and administratively through the establishment, regulation, and differentiation of racial formations that through assertion as well as ascription themselves change over time. The state's management of racial categories is analogous to the management of highways or ports or telecommunication. Racist ideological and material practices are infrastructure that needs to be updated, upgraded, and modernized periodically. This is what is meant by racialization. And the state itself, not just interests or forces external to the state, is built and enhanced through these practices. Sometimes the practices result in protecting certain racial groups, and other times they result in sacrificing them. The way this brings it all in, for me, I think it's quite obvious, is that if we think of how we make and remake people up from the perspective of things like ethnicity or race, which we do with more or less precision, more or less awareness in our work in East London, in our work with racially minoritized groups, in our public health work, and in our social research. If we are kind of conscious in kind of a hacking sense of how it's done, then we need to ask ourselves, well, why is it done? And who does it serve? Or what does it serve? And it is not a straightforward answer. But I go back to the study and understanding of ourselves as intellectuals with cultural hegemony in making knowledge in a particular time and place in history. Because we are in a post-colonial, post-imperial British environment, you and I say we are, and because we carry out research on kinds of people that have come into being through this historical process, including a fairly nefarious historical scientific process, anything from experimenting to justifying racism through the sciences. We need to understand at all times what are the, if you want, historically and politically supportive ways of making people up. And I would suggest chiefly that's done with the people themselves.
Yep.
And we need to understand what are the ways in which we are reproducing classifications to uphold these specific infrastructures. So to uphold a state which in and of itself has historically been built through this process of colonization and imperialism. So there is no separation between the country in which we live and its history and what it has been constituted by, and there is no separation between ourselves and our institutions and the communities around this institution. So we really need to be particularly conscious, I think, of where we operate from when we classify and make people up. Because we might have the best intention at heart, but we might intentionally or inadvertently, through omission or through neglect, kind of proliferate racist ideology and kind of multiply or amplify scientific practices that might, in some ways or others, reproduce particular ideologies. And in doing so, we're essentially serving a particular dominant version of the story of the place in which we are. So we are ourselves have to be conscious of our location, let's say. And not just as because I'm a white person, my location as a white, heterosexual woman, and, obviously that's all very important, but more about where we are as experts in institutions within a particular infrastructure that has an interest in sustaining certain forms of subdivision and organization, because that's where it comes from and because that's what serves its various other purposes. So it's all very diffuse. It's quite hard to pinpoint exactly. I don't think anyone's sitting around the table doing this, but if we look through this lens, so this is the lens I look through research, then you can see it happening sort of before our eyes on a regular basis.
Yes.
And it can be something simple like, thinking about health inequalities and how they're distributed across different ethnic groups. And suddenly it would look somehow as this kind of inequalities live inside these groups, as if somehow these kinds of people inherently walk around with these inequalities inside of them. The language itself sometimes is so slippery, as opposed to there are systems and structural kind of forms of, let's say, discrimination or or exclusion that create these kind of zones in which then people live, and these kinds of people end up living in these sorts of locations that then mean that they have unequal outcomes. So I'm not saying we should write it like that, but I'm saying we can quite clearly see how we can be deeply complicit in these processes if we're not sort of really, really sensitized to them. Or if we don't sensitize ourselves to the fact that this is what we're doing. Yes. And sometimes in the quest for precision, we can't say such and such communities, we have to be more specific, We then start a new cycle.
Yes, yes.
Of making people up.
Yes.
And making kinds of people. Suddenly we make new kinds of people that are more, these are the people, not the other people, These are the people and this is why they have this problem.
Yeah.
We hardly ever think these people might have this problem because we help to make them up, and out of that fall out a whole series of actions and interventions and treatments, and we don't really think that way.
Yes.
We kind of think that they are given, they're there, they might need help. And help usually means they need to be brought back to something that looks like more like our norm.
Yes, yes.
So I know it's quite long, but you have asked me the 3 ideas, and I've been doing this for 20 years. So obviously, it's quite hard to put into fewer words than that. But I think that's where I see it. That we are inside these institutions, state institutions also, and in these institutions we are experts, and as such we make knowledge and we make people up, and then we've been making certain people up in certain ways.
Yeah.
As dangerous, as problematic, and then we make them as vulnerable. Now we make them as excluded, then we make them as underserved, then we make them as marginalized, then we make them as minoritized. But in all this, we have to always be mindful that we don't actually, to some extent, forget that this is us and them together with us sometimes doing it. And if we want to do it better in a way that is more constructive or anti-racist, then people have to speak for themselves and describe what kind they are from their own eye view, which is the person's eye view, which is quite different from the institutional eye view that we as scientists have.
And I guess drawing on what you said earlier, that even that will not be pure, in the sense of like even that will have to draw upon, because of the looping effect, like there is no such thing as the kind of like stripping back everything else, but it does allow you to move closer to, and even it's not close to the unvarnished truth, but even the act of going to someone who is one of those made up people, as we're calling them here, and saying, what is it like? Even that act is important in itself ethically, right? Like even though you're never going to get to this kind of unvarnished, stripped back, taking away all the other layers that have been put on top, because these things have looped and become something different. The act of doing that is still important.
Yes, absolutely, because it shows you. So, one a classic example could be this term BAME, this dreadful thing that came up for a time and now seems to be disappearing, particularly because people have, resisted being in any way identified as such a thing, and that was an attempt to be more inclusive in an approach, instead of saying things like non-white. But then people are saying, we don't want that we don't recognize the kind, we don't recognize it as a kind in which there are that sufficiently has characteristic that puts people together.
Yes.
We have the LGBTQ plus, and the plus is because none of those things are everyone. Not everyone agrees on who should be within that.
Yeah.
Amongst those movements.
Yes.
So it's a constant back and forth. People adopt them, as you say, and often find it quite amusing why we're asking whether they're happy with the adoption of this particular label, because maybe they're not. they're interested in this process of making people up in the same way. But when that process has an effect, for example, you can only have this if you belong to X kind of people, then or X kind of people can't do this, then it becomes kind of a much harder truth that makes more sense. So in some cases it can remain an abstract in which people don't really experience themselves in that way, or live in the world as that. In other ways, it becomes so relevant to how everything is organized that it becomes inescapable. You end up living in the world as that kind of person, because the world is now built for that kind of person, and you need to kind of fit in with the kind of person that you become. So there's different levels of consciousness that you're a kind of person, and different levels of consequence, I guess. But nevertheless, sooner or later, all you have to do is step into a clinic and fill in your first form, and suddenly it's clear that you have to choose which kind of person are you on this list. And that list changes over time. The census is a classic. I mean, the census is not scientifically driven necessarily, but it is the original, tool for classifying people. And so when you have to fit, you have to choose, so it becomes real at the point of you being faced with the decision of where am I going to put myself. You can see that there's so much debate, and every few years a new thing is added and another one's taken away and all of that. So that's a kind of perhaps, helpful way of thinking about classification. But I think we go deeper than that, because we bring in biology and genes and medicine and pathologies and, and behaviors and psychology, and we bring a lot more to it than just classifying your sex, your gender. We bring so much into it.
And so the making up becomes more veiled, because it's got all of those things that look like they're just things. They're just, as it's sort of the sleight of hand of actually making it up is maybe less obvious there in the medical field than it is on the census, where it's a bit more naked.
Yeah, and kind of blunt. And then you have the courts, for example, the latest ruling, women are people who have been, were biologically female at birth. I mean, that's not making a kind of person, that's making half of the world into one thing. And that's done through a legal instrument. But then using this notion of biological sex, which obviously is a legacy of scientific work, so which is contested, very contested. So it's not like science thinks one thing, but somehow that's been picked up, and that now becomes the thing that defines the kind of person we call a woman. So, I mean, you can see this, it goes on all the time, over and over again. I guess my question to the listeners, if they're still with us, would be, what is our role, and what is our power position in this process, and what does it do, and what do we want it to do, and what do we not want it to do, as long as we know that's what we're doing. Or I believe that's what we're doing after 20 years of working in medical schools.
Thank you so much, Sarah. That's been awesome. Is there anything else you want to say?
No, God, no.
Thank you so much for speaking on the podcast today. I've really enjoyed it. And thank you everyone for listening, and we will be back with another episode soon.